The following Ardelyx podcast is intended for informational and educational purposes only and cannot be considered as medical advice. Please speak to a healthcare professional before making any treatment decisions.
Hi, welcome everyone for today's episode of our Gut Matters podcast. I'm Andrea Shin, a practicing gastroenterologist at UCLA, and I'm here with my co-host today, Joanna Ruddy, who is the Senior Director of Patient Advocacy at Ardelyx. And today, in honor of IBS Awareness Month, I'm very excited to introduce two guests that we will have with us today. I'll introduce our first guest, Jeff Roberts. Jeff is an IBS sufferer for over 25 years, and he is the founder and creator of the IBS patient support group, ibspatient.org. He's also the original founder of the IBS self-help and support group, ibsgroup.org, and the founder of World IBS Day and co-founder of Tuesday Night IBS. Jeff has been very active in the patient advocacy space. He's testified to the United States FDA several times on behalf of IBS patients, has been very active in media and press, and has received numerous awards for his work. He's been recognized by the ACG, the American College of Gastroenterology, for his work on social media, and was also awarded the Patient Influencer Travel Award at the National Digestive Diseases Week conference. He's been nominated by Helio for the Gastro Disruptive Innovators Award and was also a Lifetime Achievement finalist at Health Union's Social Health Awards. He's been active on numerous media outlets, including CBC Online, Discovery Channel, and NPR. And to top it all off, he has a very extensive and relevant educational background, obtaining his master's in Buffalo, New York, and worked on a thesis that was entitled Awareness of Childhood Health Issues on Educational Outcomes. So very excited to have Jeff with us today. Jeff, thank you so much for joining us, and I'm looking forward to a really exciting discussion.
Thank you so much, Dr. Shin.
Great, Jeff. Wow, that's an impressive bio. I'm thrilled to introduce our other guest, Erica Dermer. Erica, also known as Celiac and the Beast, is the creator of the Celiac and the Beast website, celiacandthebeast.com. Erica is a well-known digestive health expert, a blogger, and an influencer known for her work searching for the best gluten-free products and celiac disease research at trade shows and scientific symposia. She's also a sought-after speaker at gluten-free expos across the country and is a avid patient advocate for digestive health conferences like Digestive Disease Week. She is a fabulous speaker. If you've ever heard her speak, you'll be blown away by her passion for patient care. And so I'm so thrilled that she also is joining us. She also is newly, I'd say, baptized by fire into the Tuesday Night IBS family. So working closely with Jeff on that program as well. So Erica, welcome. Thanks for joining us.
Thank you. I also have some of those cool kudos that Jeff has. It's just in my
That's
bio.
right.
So
Except you're more humble than Jeff.
I'm so humble. So humble. Thank you, Joanna.
Oh, you're welcome. We're so thrilled to have both of you here with Andrea and I. I've known the two of you for a long time now. And so it's like just a bunch of friends sitting together chatting about digestive health, which is really fun. So I know, before the show started, we were kind of chatting about, what we wanted to cover today. And I think it's so interesting to me, this patient advocacy space that's really growing. And a number of companies, industry is recognizing the importance of the patient voice and the patient experience at every single level of the work that they're doing. And that is so refreshing as a patient and a patient advocate myself, because for so long, patient experience was discounted. And it was only about the experts. And what I think was missing was the expertise of the patient's lived experience with the disease. I frequently say patients are the experts of their body and what their experiences are. And so harnessing that experience is a really important part of data gathering when we're looking at these chronic conditions such as IBS.
At Ardelyx, we're dedicated to improving the lives of patients by discovering, developing, and commercializing first-in-class medicines that advance care to patients with unmet medical needs. Learn more about us at ardelyx.com.
I'd love for you both to share, what began this advocacy work for you? Why patient advocacy in IBS in particular? How did that all begin? And maybe we can start with Jeff.
So thank you, Joanna. My story kind of started when I was really, really young and really had no place to turn. When I started going to college, I would go to the medical library and just do research on this thing called IBS. There was so little information. I found some really interesting people who were doing research and started to follow with them, consult with them via email saying, what are you doing? How can I get involved? And so forth. Eventually, I started going to medical conferences. Now, here was a patient going to a medical conference, and everybody couldn't really understand what I was doing there because, to your point, nobody really felt that patients could bring anything to the experts. They might know it all. What I found is they really didn't know it all, and they were as dumbfounded about IBS as I was. But I was able to kind of, gather information and then bring it back to patients. And that's kind of how I started my patient advocacy work was I felt that I could learn something going to the conferences and bring it back to patients so that they would understand evidence-based medicine, first of all, it's not all in our heads. We really do have something wrong. Unfortunately, they don't know the cause. They don't really know how to treat it at the time when it first started. But, come forward, 10, 15 years, we do know how to treat it now. And we do know that there's a lot of other conditions that mimic IBS. And we want to make sure that people are diagnosed properly. So I spend a lot of time not diagnosing patients, but helping them understand the conversations that they're having with their physician so that they can be better informed to, spending that time. Because, we know, Andrea, in your office, you only have limited time to spend with patients, and it's really helpful for them to be informed. So I spend a lot of time trying to, give patients that information so that they can really utilize the time they have in front of their doctor.
Yeah, that's great. I love that. The one of the first patients attending these scientific conferences, that must have been something else. What was the response from the physician and researcher attendees and speakers when you told them that you were there as a patient and not as a clinician?
So they really didn't understand it. They really couldn't even have a conversation. It was almost as if I was invading their space. Hey, we're a bunch of doctors. Why would you be here? And I have to say, for the first, number of years, where I really didn't have anybody else to spend time with or just hang out with. I wasn't invited to any of the events outside, the symposiums outside of the actual events. So it's kind of lonely.
It was lonely. Yeah.
Yeah. So
Wow.
that's okay. I mean, you get past that and you just kind of, you push through it. Now, I really have more friends that are clinicians, are dietitians, are psychologists, are researchers, people working for, various pharma like yourself, Joanna. I'm really well known because I was there, such a long amount of time.
Speaking of Erica, so curious how you got started in this space and what it was like for you at that time. Was it similar to Jeff's experience?
So similar to Jeff. I started out with celiac disease. That's what I was first diagnosed with. And there was really very little advocacy going on and very little lived experience talk going on. So, of course, when they had someone who is willing and able to talk about digestive issues, people were just like foaming at the mouth to get me to speak at events. And that's great. I ended up, because of that, I ended up writing a book about celiac disease, touring a lot of the country and doing talks about celiac disease. And I ended up being the editor for the largest gluten-free magazine in the country. So because of that, I started to attend Digestive Disease Week to get more information directly from the clinicians and to be a patient advocate in celiac disease. Everyone's like, why are you here? But I don't really understand. Even on the show floor, people were just like, wait, you're a patient? And I'm like, yeah. And they're like, what? I don't know what I can give you. Do you understand this pamphlet? And I'm like, yeah, I'm scientific literate. Thank you. So I still think that there's some of that issue when we
Yes.
talk about exhibitors on the show floor not understanding what a patient advocate does. But I mean, night and day difference on what it was when I first started. And then, of course, what's interesting is I never had any real digestive symptoms for celiac disease. Mine was more just overall autoimmune. So I was 70 pounds less than I weigh right now, 100 pounds soaking wet. I had anemia. I was so sick, but not digestive sick. So I had all these other things. And then when I started getting digestive sick, I'm like, wait, what is this? And everyone's like, it's just celiac. I'm like, actually, it's not. Went to many different providers, and it ended up being IBS, and I have been treated with pharmaceuticals for it. I have gone back and forth as far as flaring, and really being able to talk about digestive symptoms and digestive issues and dealing with the psychosocial aspects of dealing with the digestive disease, regardless if it's celiac disease or IBS, because a lot of it is mimicry, right? Which is so great, that overlap of IBS, digestive issues along with celiac disease. To be able to talk about the psychosocial aspect, that's what I really thrive on, because not a lot of people want to talk about poop or bathroom habits, and I'm completely fine with doing it. And so for me, that's really what I've more aligned with. And I've always been into the psychosocial aspects of living a life that's different and understanding, the Kubler-Ross method of like going through the steps of grief, the stages of grief when you're diagnosed. So that was my main speaking point. And now that I have IBS layered on top of it, it's really unique to be able to give that perspective of like talking about disposable underwear, the things that not a lot of people talk about. I'm fine with talking about. And that's really where I shine in the IBS space as well, because I've been there, done that, and want to share with others.
That's awesome. Yeah. I think it's so interesting how our personal lived experiences have propelled us, all three of us, Jeff, Erica, and I, as patients, have propelled us into now this space of patient advocacy and patient education, and even a little bit of provider education from a patient perspective, which I think is really, really important. Andrea, I'm really curious, as the gastroenterologist here, what is your take on the importance of the patient voice now in education, particularly?
Yeah, I was actually kind of just listening to both of what Jeff and Erica were saying, and I think that the work and the effort that you've both put into learning about the disease, becoming, scientific literate and advocate for patients is so important. Because a lot of times, there's this huge gap. As scientists and as clinicians, we may have content expertise, but we don't have lived experience. A lot of patients may have lived experience, but don't really understand the medical side of it, or the biology or the science. And to actually bridge that gap is incredibly valuable. And I think it also does work to help improve communication between providers and patients, and, create this perspective of where we're working together, as opposed to feeling like, wait, we are supposed to exist in separate compartments. Kind of what Jeff was saying about not being well received, when you first started doing this work. I can totally see how that could happen, because, physicians and providers are not used to interacting with patients outside of that office visit. And so to kind of be able to envision that different relationships exist, and being open to that, I think has been very helpful for me personally. And I think that it would be helpful, across the board. But anyways, I was just thinking about all of those things as you guys were talking, and it's really wonderful what you've done.
One of the things you mentioned was communication, and I think I've really worked at trying to help patients speak in a language that their physician would understand. So put it into their terms. And even when you're at a an appointment, it's laying out things as if it's a story. This is what I've tried. This is what worked. This is what hasn't worked. I'm feeling better, but how much am I feeling better? Trying to be really as exact as possible so that, together the patient and the physician can formulate a plan. I think the days are long gone where, I really hope so anyways, where my grandmother would go to the doctor and she would follow everything to the T that the doctor would say. And we'd all say, really, you're going to do that kind of thing? And it was very one way. And I do believe that it is somewhat two-way now, although you still have patients that are not informed and you try and help them. But for the most part, the people that I'm speaking to are better informed and are having better conversations.
Yeah, that's important. I think you're right, Jeff. I think patients are much more active participants in their care. They are asking more questions instead of just blindly accepting what is being told to them. And maybe even if they don't understand it, they just take it and try to, do the best they can with it. But now there's far more questions and engagement and that two-way street that Andrea was talking about, which I think is really important because honestly, in my experience at least, the times that I've been passive with my clinicians about any of their recommendations, I have not felt that my care got any better, that my illness got any better. It was the times that I asked questions, that I was an active participant and really said, no, I don't really like that idea. What if we tried something else? That's when I really saw my outcomes start to improve. And I think that's an important point to stress to patients listening is that you need to be an active participant in your medical care with your provider. This is your health and your life. So if you don't understand what's being said to you, ask questions. If you don't agree with a certain treatment option that's being proposed, speak up. Because most of the time your provider wants to work with you and wants to find something that, is going to work for you. They're not just wanting to dictate. They want you to be a part of this decision-making process. So I think that's a really good point. Erica, when you are talking about the psychosocial aspect that resonates the most with you in this disease state in particular, I think IBS has so many psychosocial ramifications because it is or can be seen as less valid of a diagnosis many times because of its lack of biomarkers and diagnostic testing. How do you explain that biopsychosocial aspect to patients? Because I've always found that to be a nuanced thing for patients to kind of grasp. And I'm just curious how you have those conversations to empower your patients.
Yeah, I think it's something that we're all struggling with. I think I've done some mindfulness training and I've done, gut-directed hypnotherapy. And for some people, I think that's kind of like on the edge of woo-woo for them. And that's fine. I'm like, I'm not asking you to buy crystals. I have crystals. I'll be your crystal dealer, whatever. But like, no, I don't. I think explaining that to them is kind of like, what? It's not just like something I can take a pill for. I'm like, no, it is, yes. But like when we're talking about like the root of this and what are the causes, and when we talk about like stress management and like, I was like, yeah, of course I need to do stress management. Of course, I know that I'm stressed out. Yeah, of course. I think they don't understand like really this can be a component of it. I think people are way more apt to really understand the low FODMAP diet for it and understand that it could be an issue with FODMAPs because they're like, oh, it's diet-based. Okay, I'm like, yes, it can be diet-based, but it also could be, and so understanding what are the things that are affecting me. Is it my menstrual cycle or menopause or perimenopause or whatever? Is it anxiety? Is it depression? Like, what is that? And then when we start talking about using neuromodulators, that's when people are kind of like, wait, and I think it's still I don't have any magic sort of key for that. I think it's just trying to understand like, yeah, okay, this is something that my body's doing and maybe I can help understand what the triggers are and how I can help my body with it. But a lot of it does feel like, oh, this is a me thing that I've created myself, that I've done to myself. And then you start feeling a lot of the guilt and then it just starts the cycle over again. And it's hard. There's no good answer to explain to people. Like, there is a gut brain interaction, and here are the things that you need to
Right.
know. But to tell people to stop being stressed out, it's like, oh my God, now I'm stressed out. Being stressed out. And now I have to
Yeah.
manage my gut directed behavioral therapy on it. And then I have to get this person and a gut directed psychotherapist. And then I need to talk to my doctor about neuromodulators. So sometimes it can be way more stressful just even thinking about that. There's no easy answer to it. But understanding that, like, yes, there are things that I can do that maybe can ease the problem or make things a little bit better, can give people at least something to hang on to, thinking
Yeah.
that this is not just their life for the rest forever and ever, and I'm going to have this forever, and it's so debilitating. But understanding maybe there are things that I can do to make things easier. It's helpful. But again,
Yeah.
that's a real hard topic to get over, because
Yeah.
blaming yourself for something is not, doesn't make you feel any better.
Well, I totally agree. And I think there's already so much guilt in this disease state that patients feel when they don't understand and they feel out of
Mhm.
control.
Mhm.
So it's an excellent point. And really, when you think about the term biopsychosocial, that's really true of any disease, right?
Mhm.
You have the biological aspect, you have the social aspect, how it affects your quality of life and your
Mhm.
interaction with other people, and then your psychological aspect, how it affects your worldview, your mental health, etc. So I think that that's a really brilliant way of kind of setting it up for patients. Um, Jeff, when you run one of the largest patient support groups in North America. You have thousands and thousands of patients that are active on this forum and really have created this lovely community, which I think is something that so many patients are craving when they are feeling lost or have a lot of questions. Um, how does that work? Are you moderating certain questions? Are you just letting everyone communicate with each other organically? How do you bring in any sort of patient education to that process?
So it's a very good question. So what started off as myself really talking to myself initially with posts and just hoping that somebody would find me. I now find that patients come looking for other patients. They want to validate, first of all, what they have, and they want to know that they're not alone. And once they get past that, then they start asking questions. And it is a very much of an open forum where other patients can respond. And then as a moderator, I try and steer that conversation to be evidence-based. And so saying, hey, that doesn't look right. You really need to go back to your doctor and have a conversation, because that's not usual for somebody with IBS. So I stick to just IBS and not start going outside of that, like the mimickers. Like a lot of patients do have celiac when they're presenting with diarrhea, predominant like IBS, but it actually could just be celiac. And I don't want to get there. I want them to focus on that. So, what started off as, a few thousand people, I now find which is typical of the internet, is that a lot of people come to read the things,
Mhm.
not actually either contribute or ask a question. So over the last several months, it's crazy, but I'm seeing 1.5 million visitors
Oh my.
through the community on a monthly basis. And I'm like completely blown away by this,
It's
because,
huge.
social has really taken over.
Wow.
Facebook and Instagram and TikTok. I'm not on TikTok. I am on Instagram, and I do have another community on Facebook. They're different communities.
Mm.
Facebook is much more interactive, whereas on the website community, patients will ask a question. Somebody might answer, I might answer, but there's just way more people that are just coming through and viewing. And that's perfectly fine, because as long as I'm maintaining, evidence-based information, I'm feeling comfortable that patients are getting the information that they want. But I'm completely blown away, given the social networks that are out there, that a community forum is still something that patients really resonates with patients, and they do come to it.
That's amazing. I mean, I think it speaks to what you just said, the need for community and the feeling that so many patients can have is a feeling of isolation with IBS. So this sense of community, even, online, in person, it doesn't matter, that building that community, that safe space was really, really something that patients were needing.
Yeah, it doesn't, I mean, it doesn't really stop there because, as Andrea went through my bio, and yeah, I've done a lot of things over time. Tuesday Night IBS and World IBS Day are a whole different set of issues.
Yeah.
So
We want
Tuesday,
to we
yeah.
want to ask you about that next.
Okay. So Tuesday Night IBS is a place where both patients and health providers come together to share research and guidance, and most importantly, support. And it was created with the patient experience in mind, and it continues to be that way. And we have these wonderful webinars on a monthly basis where we talk about, real clinical work that's actually happening and what might be coming down the path in terms of the research as to what might be able to, treat patients in the future. And then World IBS Day came up because, I felt that patients really deserve to be, what's the word I look for? To
Honored,
Acknowledge.
acknowledge,
There you go.
recognize.
Thank you. Patients should be acknowledged with the day. And it's been incredibly successful with the help of Ardelyx, especially with lighting up the sky. I mean, we lit up Boston last week. So World IBS Day is on April the 19th. We lit up Boston one night. I was in Milwaukee on the day before. And then on Saturday, World IBS Day, we had various other centers that were lit. We have proclamations that have been done by various governors and states. So I think this year we had Massachusetts, we had New York State, we have Wisconsin. It's really becoming...
Erica got Arizona.
Erica got Arizona. It's not just a North American event. It really has become a worldwide event. And I think there was just this
Awesome.
this need that we identify patients feel like they're part of something, and then let patients know that there are others that really do care. And, back to Andrea's point and back to Erica's point, doctors really do want to help patients. That's why they're there. They really want them to feel better and get better. And I think I've tried to drive that message home when patients talk about physicians that aren't listening with them. I said, they really do want you to feel better. That's their role. You need to work with them, and you might need to coach them a little bit as to how they can help you. But I mean, I think we want to do that with World IBS Day as well, is to make patients aware that there are people out there, there are organizations like Ardelyx and others that do want to help patients and do want patients to feel better and have a better quality of life.
Yeah, absolutely. It's a great awareness day that you've built, and I've been able to see it grow, from the first year you started it to this global, just amazing campaign. If you are on social media and you follow the hashtag, you see countries from all over the world
Everywhere.
it's unbelievable. Latin American countries, African countries, Asia. I mean, it's all over. It's really phenomenal. So well done on that campaign, and Tuesday Night IBS as well, doing so well. Erica, I know you just recently joined Jeff in that process of education for patients and providers on Tuesday Night IBS. What are your plans for this year with that platform?
Yeah.
What
So
can you tell us?
secret. No, I think bringing just a different voice into these organizations are always great. So when I started Celiac and the Beast, I really was just like video content and memes and other things that are just like not really standard for care in IBS, especially video, especially these short snippets that how people are viewing content nowadays. So I'm coming from it from a content point of view, and what we can do, we have such incredible, amazing content that has been produced over the years.
Yeah.
And we just need to make sure that we're getting it out there in the platforms that people are actually on and viewing. So while I'm not asking Jeff to start learning TikTok dances quite yet,
Oh,
that's not,
darn.
that's not what it's about. But it's the fact that, and this is a huge point, we need to be where people are talking
Yeah.
about this, because if we're not, and we're the same voices in the room, other people are doing it for us. And that's the problem.
Mm.
Because if we don't have educated patients who actually are doing evidence-based science and scientific literate patients, you have a lot of people saying a lot of things that are not science-based, evidence-based for literally anything based, like based on vibes. I don't know.
Yes.
It's just like these really, really poor choices that people are making online because all they're seeing are influencers that don't have the right information or really understand any point of information when it comes to science. So Jeff and I are out there fighting. I think that's another portion of what Tuesday Night IBS can become as well. We need to be out there, and we need to be out there in the content in which people are getting their content, because there's already content creators out there that are not saying the right things, that are not saying evidence-based, and that's scary. So for us, it's always been about like fighting misinformation. On the celiac side, that's what I've always done. So I'm hoping to bring a lot of that to Tuesday Night IBS, and just to be able to spend more time producing more content from all the great stuff that we've already produced. I mean, the animals of information that we have are incredible. The physicians that we've had as part of the webinar series has been amazing. I mean, the Tuesday Night IBS before I came on is perfect. So it's really just trying to figure out how we can disperse this information to more people. So webinars, podcasts, being in all the places in which people consume media, that's where I'm hoping we can bring Tuesday Night IBS to help combat those people out there who are maybe the lone voices on those platforms, and we need to be the educated voices for them.
Yeah, I think that's great. Eric, Andrea and I have talked before about the challenges that she faces as a clinician when patients come to her with misinformation, and asking her about, weird treatments that are not evidence-based, and testing that's not warranted, and just a number of things. So Andrea, how important is it for, in your mind as a clinician, for patients to have access to evidence-based, scientifically appropriate information about IBS?
I think especially in the modern era, it's absolutely crucial for people to have access to, to vetted information, to validated data. There's just so much information out there, and it can get really overwhelming for people, especially when you're really struggling, confused, suffering. You don't really know what is right, what's wrong. And it's a pretty common scenario I see, that people have gone down multiple pathways, tried so many different things, and it just starts to feel really hopeless. Um, and then obviously you don't want people spending, excessive amounts of money either on, treatments that, probably are helpful for someone else's pocket, but maybe not necessarily for their own benefit.
Exactly.
Yeah. And so, the work that Eric and Jeff are doing is so valuable for that reason. Not only are they coming from the perspective of being a patient, I think there's an added level of trust that people have when it's like, you understand my experience. You're doing this for a true, reason. There's you have a compass that's pointing you in the direction of based on, you've lived it. And so I think that to have advocates like them to help other people, through navigate this information is exceptionally valuable, because obviously I think as physicians, providers, we have a role as well. And that's an important part of what we do. But it is different, when you're coming from the perspective of, telling someone about their condition rather than going through it with them, So I think that's a really unique aspect of it. So more information, the better. And we have to help guide people to the correct sources.
To your point, Andrea, just at an ECG meeting several years ago, fellows were approaching me because they saw my face from Tuesday Night IBS, and they are relying on that information actually to guide them, because they don't necessarily have access to, evidence-based information while they're going through school or their training and so forth. So they're leveraging that information. And I guess it's also coming from a patient, and because we're having, physicians with us as well, or dietitians or psychologists, at the same time, they do feel that it's credible information. So it's really important. I think I really feel our role, Eric and my role, is very important. And, we take it very seriously.
And that's a big part of what patient advocacy is too, is always have our listening ears on to what's going on in our community and making sure that we're addressing the concerns that they're having, which is something that is not always found by people outside of the community. So
Sure.
that's one benefit of being able to have patient advocates in this digestive disease space is not only are we patients, but we understand what other patients are going through as well. And I think that that's a huge point on what a professional patient advocate is and what we can offer to the community. Because we're not just here sucking up information, we're a part of it all. And to be able to work with providers, to be able to work with industry experts, like that's a huge part of our role. And that's a huge gift that we've given to the community by sacrificing our time. Unfortunately, we've been given these conditions. I don't know what I've done in my past life to have multiple autoimmune diseases, but we're not going to go there. But still, I have this, and this is the role that I've decided to, use this one life with.
Right.
And we are such a great asset to the community by what we're giving, not only being a patient and evidence-based, but what we can offer as well. And I think that that's part of it too, is we're really part of this community. And the more that people at DDW and ECG see us as part of the community, I think the better, because everyone benefits.
Well, I think
Yeah.
actually there's a little secret that I don't think people would know, and I think Joanna would know this, is I have not met a patient advocate that isn't doing this because they want a better quality of life for themselves. They are
Mhm.
looking for answers to help themselves. So we're not only leading the community, we are definitely part of the community because we
Yeah.
also, we suffer from these conditions. We're not immune to them. We have bad days.
Absolutely.
And yet we, put a smile on and come on a podcast. And not great right now, but I might not be feeling great inside, but you get through it. I think that's what's really helped me, because I came up with the phrase for myself, I'll roll with the punches. I know it's going to get better. It's not going to be as bad as this all day. It's going to get better. I just need to get through this and then just get on with my day. And I think a lot of patients with IBS get really stuck thinking the worst is going to happen and it's going to continue. And how am I going to do this? How am I going to go to work? How am I going to get on the bus? And so forth. And I think it helps working sometimes with CBT to get them past that. So that's
Yeah.
why these treatments work all in conjunction with each other to help patients realize, no, they can get past this. Like myself, I mean, getting on a plane, traveling 5 hours somewhere. I'm not thrilled about it, but I'll manage. It's not that, that I haven't managed before. That's very, very helpful to roll with the punches and keep going.
Yeah, I totally agree with you, Jeff. And I think for a lot of us too, being able to know that we're through our experiences, good and bad, and sharing them, that's making a meaningful difference in the life of someone else. Whether or not we ever get to meet them is irrelevant. Just knowing that our story and our work is helping other patients feel less alone, less isolated, find access to care that they didn't have before, etc., makes it worthwhile in the end, even on those bad days. So I certainly appreciate what both of you are doing, and know from a personal perspective how hard it is sometimes on those bad days. So thank you very much. We're running a little short on time, so I want to make sure that we have time to hear your final takeaways for patients and doctors as we close out this IBS Awareness Month episode. So, Erica, you want to start and give us your final takeaways for patients and docs?
Yeah, I think the biggest thing for physicians is just to trust patients and to listen to patients. I know that that seems like a duh, but here we are, and just making sure that I've been so fortunate to meet so many incredible GIs through my time in patient advocacy. And then I have to realize that some GIs are not these conferences that we meet. Some GIs are just perfectly fine going on the status quo, and nothing against them. That's their job. That's fine. But when we have patients that meet these people, I'm just like, oh yeah, sometimes you get a GI that doesn't really care. And it's just understanding that GIs are just like people. Sometimes IBS is not their forte. Maybe that's not what they're interested in. But also, what can we do as patients to help them? So it's a two-way street, right? For GIs, I want them to listen and trust patients. But for patients, I need them to be open and honest with their provider. I need them to have a relationship with them in which they're willing to say the good, the bad, the ugly, and for them to give them enough detail to make informed decision. Because without the two, without the GI listening and trusting patients, but without the patients actually trusting their GI to have an open conversation with them, the two shall not meet. We won't have the best care unless really both of them are willing to put in the work. And I know that's hard to do. You're already feeling horrible. Why do I want to put in the work? The GI should just know these things about me. Well, they can't read minds. Unfortunately, that's not a skill set that any doctors have at this point in time. But also for GIs to really understand, like, the patients are dealing with a lot. So a little bit of grace, a little bit of listening ears, and a little bit of like just trust with them can make us all have a better experience.
Great takeaways, Jeff.
Well, first of all, I want to thank Ardelyx for really stepping up and thinking of the patient and putting the podcast together that both informs patients and probably clinicians as well as to what patients might be thinking and what clinicians should be thinking about. So I have 3 points that I want clinicians to think about when a patient is sitting in front of them is, one, patients want to know that they're not alone, that other people have similar situation as them. Patients want to know how to make sense of a diagnosis and where do they go from here. They don't want to be just handed a piece of paper and saying, follow this or do this. They really don't want to know how do they get going on their life. But really what they want to know, will they ever be normal again? Patients want to know, will they get past this? Will it go away? If not, and I think the answers that I hear from a lot of gastroenterologists that especially work with patients with IBS is, it's not going to go away, but you will be able to live with it. And I'm going to help you find a treatment plan that will give you a better quality of life. So you can enjoy, going to your child's soccer game or going on your family vacation. All of these things, which I didn't know and I couldn't do until I actually found something that worked better for me. And I realized that I could actually get on with my life, even though I have this. It's not going away. Nobody has all the answers, but working with somebody who is interested in you and wants to work with you to give you a better quality of life, that's the key.
Yeah, that's great. So I think, what you both are emphasizing is trust, communication, and partnership, which is key to any good relationship, patient and doctor, any relationship. Andrea, any final thoughts from you as we close the show today?
No, I just want to thank Erica and Jeff so much for what they do. Like Erica was pointing out, you guys are volunteering your time to do this, to make an effort to really be advocates of the condition as people who are living with it. And I think that's really an admirable, and the work that you're doing is so critical, especially in this day and age. So thank you both. And I think that as physicians and providers, we really benefit from that as well. So it's a patient advocate, but it also helps the provider side a lot. So thank you guys for both joining us.
Thank you very much.
Yeah. Well, thank you both. I couldn't have said it better myself. It was lovely chatting with both of you today. We will place the websites for all your different resources for patients in the show notes for everyone to grab and be able to utilize. And everyone, thanks for joining us for another episode of Gut Matters. We'll see you next time.